Lakshmi is there. Yeah. So, and I can see Asifa. So, today we are going to, I have already given the two case scenarios. You can see them on the screen. One is the fertility, one I took from fertility preservation options, which is a very important topic, and nowadays frequently they're asking. And it is a talk article. The second case is the gynae case. Well, so one from each module I took. So today is the last day. So no, today we are discussing two cases. So total will be six cases. So tomorrow, whoever is interested, they can give their names in the group and they can present to Dr. Padma. And the link will be sent to you between from 7 to 9, and you can register. So now we'll start off with the fertility options. Then this is the simulated patient task. They can be a structured discussion. They can be in anything can be structured discussion. Anything can be simulated patient task. So here you have this patient. It is a simulated patient task, and they will give you the exam in the examination will be given that they will say you have to assess the following. The same typical cases will come. They will say assess the following. What you have to assess, those things you have to give more importance. There are five domains. Whatever they ask you, you concentrate more on that. So they ask patient safety. That is always there in every case. Applied clinical knowledge again is there in every case, and communication with the colleagues, and information gathering. So these are the things, and also they will be, of course, they are asking like this. So concentrate more on this. Then this case, your ST5. You're ST5 in a gynecology clinic. So this is the gynecology clinic. You are about to see. You're about to see Mrs. Julia Robert. She's 35 years. She has come to discuss her fertility preservation options. Her BMI is 26. It is normal. So now you have 10 minutes in which you should obtain a brief targeted history, explain fertility preservation options, and also answer all her concerns. So this is the common thing which is given in every case scenario. So now we'll start off with this case. So it is a subfertility case. Hello, start with introduction. And when we start the course, or if there is time today, I will just tell you briefly about what you should take in the history and overall in a fertility case. So, hello, start off with this. I'm so and so, one of the doctors in the fertility clinic. May I confirm your name and age, please? As usual. And so, I'm Mrs. Julia Robert. And I'm 35. So how may I address you? So you can call me Julia, doctor. So then, Julia, when you take the name, if you remember, you take. Julia, I can see from your notes that we are meeting today because you are looking to delay your pregnancy, delay your pregnancy, and so you are want to discuss about the fertility options. So here, am I correct? Just this is the agenda. So then you start off. So I appreciate your concerns, but can you tell me why? What is the reason you want to delay? You need to know why she want to delay because everybody will not ask. So I would like to know what's the reason to delay? Can you tell me? I respect your decision. Whatever decision you take, I respect, and we are here to help and support you. So, and then she will say, doctor, why she wanted that she must be more interested in her profession, or she's studying, or whatever. She has some responsibility. Whatever she wants, she will tell you why she want to delay. Then if once she says a reason, you say, I respect your decision, and whatever decision you take, I'll support it. Do you have any idea about fertility preservation options? Some people do have. Just to see her understanding. Do you have any idea about fertility preservation techniques, options? No doctor or yes doctor, she will say. Then, okay, I'll explain to you about those in a couple of minutes. But before that, can I get a few details from you which help me to plan to make a management plan? Then she will open question. Now you ask a open question. So here she may not have any symptoms. She is not coming with the symptoms. She is coming for your advice. So there may not be any bleeding, discharge, nothing will be there. So she will say, doctor, I came for the techniques. Then you need to ask a few questions from the gynec. So first in a gynec case or in a subfertility case, other than the obstetrics, it should be gynec history first, then you have to go for obstetric history. But in an antenatal case, it is the obstetric history first, and then you are going for the gynec history. Now in the gynec history, you want to ask about the last menstrual period. It is very important. Start off with the LMP. Don't say LMP. Last menstrual. When was your last menstrual period? Or when was your period last? Can you tell me? Then she'll say whatever day, 3 weeks or 4 weeks or some date she will say. Then are you cycle regular? because that also is important. Are your cycles regular? Then, any pain during periods? Because you want to know whether an underlying endometriosis. Any pain during periods? Are you using any contraceptives? Because she want to delay, postpone the pregnancy. Are you using any contraceptives? If she says yes, what type? Then, are you, because she is now 35, you can say, are you regular with your cervical screening? Are they normal? That's all. This is the gynec. And quickly finish off the gynec. And have you, now coming to the obstetric history, have you been pregnant before? Then, if she says yes, then you take about the history of the pregnancies. If she says no, then there's no need of taking any obstetric history. If yes, she will you ask her what type of pregnancy, whether she had a full-term pregnancy, and if so, a preterm pregnancy, whether it is a normal delivery or cesarean section, how is the baby at the time of delivery, and what's the weight of the baby, and how is the baby doing now. So these are the things which you should ask in the, if it is a normal delivery or cesarean section, and how was her recovery. Then, if it is a miscarriage, suppose she says, no doctor, I had a miscarriage. Then you, any one or two or any miscarriages, you ask a few questions. What was the gestation age? Same, which yesterday I explained to you. What was the gestation age at the time of miscarriage? Was a scan done? Have they seen the heartbeat? Has a heartbeat of the baby seen? And how was it managed? Whether you were given medicines or some small operation to remove the pregnancy tissue, or they have not given anything and it came by itself. And how was your recovery? Always recovery after a miscarriage, after anything, after an operation, after a delivery. Now, that is over. Now, coming to the medical history. So, after gynec and obstetric, coming to the medical history, are you on any long-term medication? So that is one thing. Here specifically, you need to know the ovary function, because if she postpones the pregnancy and the ovary is compromised due to disease or due to cancers, so then it is not advisable to postpone her pregnancy. So we have to ask her on long-term medication that is over. That is whether diabetes or hypertension. She will say. You specifically ask, do you have any cancers? Any cancers, because we need to know whether ovarian cancer is, whether she had and she has taken treatment. If she says yes, then you say, have you taken any treatment for that, like injection, taking the cancer killing cells injections which kill the cancer cells, or any radiation treatment? Have they if she says yes, she had cancer, then only you ask. If she says no doctor, then no need to ask about these treatments. So you have to ask about treatment, any medical cancers, treatment, radiotherapy, and chemotherapy. Now, any allergies? Do you have, that's I already told you, allergy is very important. Do you have any allergies? And any operation on your and any blood group also. Without blood group, don't move on. Then coming to the surgical history, surgery, have you undergone any operations in the tummy or down below? On the ovaries specifically, you can ask on the ovaries, because sometimes one ovary will be removed, sometimes cyst will be removed, when the ovarian reserve will come down. You want to know the ovarian reserve before advising her. That is why. So have you undergone any operations on the in the tummy, low down, or on the ovaries? Then any family history. Now, family history of any genetic problems, any concerns. Anyone, means her mother or her sisters, if she has had for them, have the period stopped much early? That means you are asking premature ovarian failure. So have the period stopped for them much early, before 40, much early? So then coming to the social history, then can you tell me, whether do you smoke or take alcohol? If so, if she, and pardon me for asking, and pardon me for asking, then only you ask drugs. If she says smoking, yes. If she says alcohol, yes, then you say, smoking is not good for health. And if you permit, I will refer you to the NHS smoking cessation center. So that is, so if you permit, then alcohol also, you say the same thing. If she says, no, I don't smoke, then no need to say. Then, can you tell me what is your height weight ratio or BMI? If she, so it should be less than, ideally it should be less than 27. And sometimes the NHS, they won't give any fund if it is more than 30. So BMI is important. Then, now you're coming to the, can I ask a few personal questions? Whenever you ask a relationship, you have to take permission. Signpost. Can I ask a few personal questions? Are you in relationship now? Because sometimes what happened, single mother also can go for fertility preservation because they are not in a relationship, but they want to postpone the pregnancy, so they want to preserve. Some people, they married or they stay together, but they want to postpone. So you need to confirm, are you in relationship? Then she will say yes. In that case, you say how long. Then so then if she says because you need to, when you discuss the fertility options, it is important. I'll tell you about it. Then how long are you in this relationship? Then in that case, if she is in relationship, have you decided, have you, both you and your partner, decided that your partner will be the father of your child? Father of your child? Because then he will be, we will be preserving the embryos. So then if she says, no, doctor, I'm not in relationship, no need of asking all these things. Now, so would you like to add anything? History is over. Would you like to add anything? That's all. Now, examination, there is no point in examination. She came to discuss with you. And she doesn't have any symptoms. So you can omit the examination. Now, Julia, now coming to the discussion, that is the applied clinical knowledge. Now, let me tell you that as you, because you have come for to discuss the to delay the pregnancy and then to discuss fertility options, we have three options. We have three options. One is egg freeze. You can take a paper and write down on that. You can say, we can do the egg freezing, we can do the embryo freezing, 1, 2, and we can do the ovarian tissue freezing, freezing of the ovarian tissue. Let me explain to you each, about each. I will explain to you about each. Now, so then coming to the see before the, then in this egg freezing, it is these things, these egg freezing or embryo freezing or ovarian tissue freezing, they are done through a process. They are done through a process that is which is an advanced technique called in vitro fertilization, or that is it is otherwise called test tube baby. It is done at licensed centers, licensed fertility clinics, which are regulated by the by the Human Fertilization and Embryology Act. If you say you remember that, you say, otherwise don't say. But they are done in the licensed fertility clinics. So what we do, how we are going to do now? So you told her, gave the options: egg freezing, embryo freezing, or tissue freezing. Now, how we are going to do? So you're going to refer her to the fertility clinics, licensed fertility clinic, and then so they will explain to you. So what to be done for you? So this fertility clinic, they have got a team of doctors, team of specialist doctors. So they will, before they start the procedure, they will explain to you. They will explain to you, and they will take, it is the paperwork will be done. A consent will be taken from you. Written consent will be taken from you about the procedure, and then they will do a few tests. They will screen for your blood test. They will do a blood test, few blood tests to see whether you have any infections like HIV and hepatitis B and C, and they will also do some hormone tests for you to know your ovary function, whether you have enough ovary reserve. That is by doing some hormones called FSH and AMH. And third thing is, they will do ask for a scan to check whether your ovary, how the uterus or womb is looking, and how the ovaries are looking, and also what is the ovarian reserve, how many cysts or follicles are there, that is egg containing sacs, how many follicles are there. So they will see, to check, to have an idea about your ovarian reserve. So that is this is about the things they will do before they start the procedure. And second thing what they do is, so first is all this investigation they will do. Second, they will advise you about the lifestyle modification. Suppose you are obese. So, here in this case, she is normal. So don't need to mention. So, but if some people in a station, if they give you the higher BMI, you have to say you should be optimal weight should be there for them to start the treatment. So they, if it is more, they will advise weight reduction. So if the patient comes to you with a BMI, high BMI, then you say weight reduction. Then if she smokes, in the history, if she says that she smokes, then you have to say stop smoking and alcohol. So these are the lifestyle modification depending upon the station. If the station says that the woman is smoking, taking alcohol, then only you say. If she is not taking, smoking, nothing, then no need to say. Then coming now, after the investigations, then lifestyle modification, then about the procedure, how it is started, let me tell you. The fertility, it takes this procedure, this treatment will take around 2 to 3 weeks from the start of your period. So the treatment will be started from the starting of the period, and it will take around 2 to 3 weeks. So we will some injections will be given to make ovaries produce more number of eggs, and at the time during treatment, when you take injections, you will be called for scanning. They will do the scanning regularly to see the growth of these follicles. That is indirectly eggs. So when the eggs become, when the eggs contained in the follicle reach some size, some adequate size, so then you are put you are then egg collection. You will be told about the egg collection. You will be put under sleep, and eggs are collected, and then immediately these eggs, after collection, they are placed in a freezing solution. Immediately they are put in the freezing solution which protects the eggs. Then these eggs are frozen in liquid nitrogen by two methods. It can be slow freezing method or it can be fast freezing method. But fast freezing method is usually preferred. So now, this usually any young woman who is less than 38 or 37, we expect around 7 to 14 eggs usually, because they have good reserve. And if the more the age, the less the number of eggs we get. So then we can, second thing, now we have collected the eggs. Then you're telling average we can get this type of eggs, this many eggs. Third thing, storing. We will store in the, already you stored in the liquid nitrogen. For how long? So you need to tell, we will store them for up till you are 55 years. Till you are 55 years. And every 10 years, we will take your consent for renewal. We'll take the consent every 10 years for renewal. If you anytime you don't want to consent for the freezing in future, anytime you want to withdraw or you don't want to consent, then the clinic may destroy these eggs or embryos which are frozen. So that is about this. Then second thing, when you take the injections, there can be some side effects. That is, because they stimulate the ovary to produce more number of eggs, they can lead to some condition called the ovary will become enlarged and it becomes hyperstimulated. So it can have some problems, issues on the body. So then during collection, there can be injury to the blood vessels, injury to the bowel bladder, there can be infection, and because of these procedures, there can be blood clot formation. The blood can thicken and clot can form in the legs and lungs. So these are the things which I need risk and benefits. Now, this is an important decision to make. So that is why you need to take this is an important decision. You need to think about it. So then for the second thing is, this is it can be done either we can preserve the eggs or we can go for the embryo preservation. Let me that you can decide about it, what you want. Suppose then second thing is, which I would like to say before this, I would like to say, in future, when we preserve these eggs in future, when I already told you, if you withdraw the consent, they will be destroyed. But if in case unfortunately, the woman, don't say you, the woman becomes incompetent, or she will already cancel the consent we told, or dies, the woman dies, then what to do with those embryos? That is an important thing, no? So you should say, then those embryos can be donated to the others, or to donate to others, or they can be used for research purpose with her consent only, or disposed. So that means, so these are the things which will be done about the frozen embryos or frozen eggs. Now, next, once you decide, so this is about the procedure. Now, once you decide to try for a baby, so eggs are stored now. Eggs are collected and they are stored. So once you decide to have a baby, these eggs are removed from the liquid nitrogen, and they are thawed means they are brought to the room temperature. Then they are fertilized with the sperm of your partner, and after fertilization, embryo is formed. This embryo is transferred to the womb. So the success rate of this is around 1 it is 1 in 4. Average, it is 1 in 4 globally. Then this is about the egg freezing. Can I tell you about the embryo other method? Can I tell you? The other method is called embryo freezing. That is, if when you are in a stable relationship, stable relationship, and you have a partner, then you wish to have a baby with him, then this option is suitable for you. That is the embryo cryopreservation. Here, similarly, same procedure is done. Injections are given to make ovaries produce more number of eggs, and once eggs come to adequate size, we can do the egg collection and then simplify. You can say simplify because already explained. We collect the eggs and we fertilize with the sperms of your partner, and then a baby is formed, that is called embryo, and then these embryos now they can be cryopreserved. Whenever you want them whenever you want to have a baby, they can be transferred. That is, similarly, they will be, when you plan for a pregnancy, they will be removed from the cryopreservation and they will be brought to the room temperature, thawed, and transferred will be done. So this is the embryo transfer. So but there is a difference. I would like to say there is a difference between storing the embryo cryopreservation and egg cryopreservation. So can I explain to you the difference? Yes, doctor. So embryo has a stable structure. Embryo means it is a multi-cell stage, around 4 to 5 cells embryo. So then it is preserved, actually cryopreserved. So this embryo, which is around 4 to 5 cells, this is has a stable structure. And so when at the time of thawing, they are stable. They will not get damaged. Whereas, but when it comes to egg, it is a single structure. So when at the time of thawing, that becomes it can get destroyed. It can just get destroyed by itself. It is not a stable structure. So because the embryo is stable, the chance of pregnancy are more with the frozen embryo transfer, that is 1 in 3, compared to frozen eggs, where the pregnancy rates will be 1 in 4. So this is 1 in 3, that is 1 in 4. That is about the embryo and egg. Can I tell you about the chances of pregnancy with fresh embryo? That is embryo just formed and we will transfer immediately without storing, and frozen embryo. Can I tell you? If she says yes, you tell. If she says no, don't need to say. Second thing is, see the time. If you feel you're crossing the limit, no need to say. So now, then just for your knowledge, I'm telling you. So the chances of pregnancy are more with frozen embryo than with the fresh embryo transfer. Because in this fresh embryo transfer, in the current cycle, many hormones will be given to stimulate the ovary. So then the body hormonal milieu will not be favorable for embryo implantation. So always when you transfer the body may not take up this embryo. So, but if the embryos are, on the other hand, if the embryos are frozen and they are transferred after 1 or 2 months in another cycle, then this hormonal effect will come to normal, and then the womb will take up the body will take up the embryos more chances. So then so this is about the egg freezing and embryo freezing. Can I tell you about the third option? What we have? Yes, doctor. Then because you are supposed to say all the options. The third option is we take out the ovarian tissue and preserve it. The tissue is removed, so it is through a small keyhole surgery. Through a keyhole surgery, we put you under sleep, and then we take a piece of ovarian tissue and cryopreserve it, store it. Once you are ready, then we will again transfer back this tissue into the body. But let me tell you, this is usually done in young girls. Before the period start, usually it is done in the young girls in certain conditions. So now this is about the embryo cryopreservation techniques. Am I clear so far? So now can I tell you the other aspect? When you become pregnant, if you delay the pregnancy, I would like to say what will happen. What issues can come to the mother and the baby? Can I tell you? If she asks yes, then you say. If she doesn't ask, say then no. So, but you need to know. Then see, when suppose because you want to delay the pregnancy, if you will delay beyond 40 years, because the chance of complications, issues coming to the mother and the baby can be more. That is, mother can have increase in the blood pressure, increase in the sugars, and blood can thicken and clot form, and there can be increased chances of having a cesarean operation, and also after delivery there can be more chance of having bleeding. And so then the other thing what can happen is to the baby. The baby also there can be miscarriages if you plan pregnancy at a later age. Then the baby can be small, or the baby can come early, that is preterm labor. And sometimes what happens during delivery, the baby's heartbeat can stop, that is stillbirth. So these are the issues that can happen. So now that I have given you the options, you can think about and get back to us. So then she will say, doctor, is there any long term, because of these treatments, this test tube baby, can it affect my baby's mental health or anything, physical health? So you say, we have less data about the long term effect of these things on the babies. We have less data. There is a frozen, especially frozen embryos. They will have a doubt about the frozen embryos. So you say we have less data. So now, am I clear so far? Then, any other concern? Do you have any other doubt or any other question? Do you have any other questions? So now I will document whatever we have discussed. This is an information, written information leaflet which contains about what we have discussed. So you are giving the relevant, related information leaflet only. So then I will connect you to the support group, and then I will connect you to the counselor also. So then once you decide, we will about the starting the treatment, we will refer you to the fertility specialist. So thank you for your time. So this way you have to take it through and take the fertility for this case, fertility options. So it is a talk, there is a talk article you can go through. Now second thing is, like the other case, now that is over, that case is over. Now moving on to the gynae case. So I just, as I told you, I'm taking one case from one module. So today I thought, let me tell you about the gynae case, how you're supposed to present. So now this is the case we have. I'm going to present a lichen sclerosis, which is very commonly asked. The common presentation and commonly asked in the exam also. This is a simulated patient task. You have to see what type of case it is always. It is a structured discussion or simulated task. What clinic you are. Where are you? In the gynecology clinic or subfertility clinic or reproductive clinic, whatever. Whichever you are there, you have to see that. Then take that name. So this is a simulated patient task. You are an ST5 in a gynae clinic. So you are about to see your next patient is referred by a GP. That the GP letter will be there. So sometimes in some cases stations there will be GP. Some stations the GP letter GP will be referring. So if the GP letter is there, then they will give the details. Sometimes he will do some investigations. Sometimes he will give some treatment also, and some scan images and some these things will be there. So see everything whatever GP has written. The GP letter says, referring Mrs. Jasmine Thomas, 56-year-old. She is suffering from vulval itching since 1 year. I have given her antifungal treatment and then some steroid ointment to apply locally to the local area, but she did not respond to the treatment. She did not respond to the treatment. She has been advised some investigations also. I have advised her some investigations, the results of which are given below. And kindly do the needful for her. Kindly see her and do the needful. So this will be the letter. And the investigations, whatever he has done, they will be given in the exam. So you have to see what investigations are done for her. So here you can see always whenever investigations, anything, any surgery details or investigations or scan report or observations, blood pressure, pulse rate, everything, BM, you have to check, confirm whether it is the same name in what is given in the case here or whether it's a different. So here, this is what case. So it is Julia Robert. Okay. What is here? Jasmine. So it is not her. Okay. That is why be very careful. You have to see this and this. Say it should be same name. Okay. Age also. They can be same name and same the age. Sometimes they can be same age, NHS number also. So always confirm. Now here, always if it is if they say it is different name, don't explain this thing to her. I'm sorry, it doesn't belong to you. Let me get your investigations. So you need to say that. Sometimes intentionally they'll keep the wrong report. Then hemoglobin, that is blood strength, it is 9. That is normally it is 11. So whatever is abnormal, explain to her first. Then 11 to 14 is normal. It is lower side, on the lower side. That could be due to any reason. WBC is normal, and platelets also, these are all normal. So what I could see is that you have your blood sugar is also normal. So then MCV, the only two abnormalities are here. One is mean corpuscle volume, the cells are bigger. That is, it is 110, normal it is up to 100, it is a 110, the volume is more and the blood strength is less. So the cells are larger. So from this you can know that these are the two abnormal things. Her BMI is okay now, 26. So now what is your task? You have to obtain a brief targeted history, that is about the itching and all. Explain, sorry. Sorry. Explain her, it is from the previous thing I just spilled out. I will tell you what you need to say. You have to take the targeted history, explain to her the address her concerns, give her management plan. So this way you have to treat her. Now you start the case. So hello, you are starting the case. Hello, I am so and so, one of the doctors in the gynae clinic. May I confirm your name and age, please? So she will say, Doctor, I am Mrs. Jasmine Thomas and 56. How may I address you? You can call me Jasmine. So that is introduction. So every time I am repeating so that you will not forget. Jasmine, now you can take her name so that it will be comfortable for you and she also for the conversation. I can see from your GP letter, agenda. I can see from your GP letter that you have some concerns. Concerns, and so so you are here to discuss today. So, am I correct? Yes, doctor. I also see that you just say some concerns. No, you need not say itching. You can say some concerns. Then when you ask in detail, you can ask about itching. Then I also see that some blood tests are done for you, which are attached here. And I'll be discussing them about in a couple of minutes. I shall address, let me tell you, Jasmine, I shall address all your concerns because she has some concerns. Say, I shall address all your concerns and give you the management option. But before that, can I get a few details from you? Can you tell me more about your concern? Then that is the open question. So, doctor, I have itching. The same thing, whatever GP has said. So, what I have itching. Then once about the itching, she says itching. You need to ask about details about itching. So, you ask her when it started. When it started, whether it's more during, she will say whatever when means how many months or years she will say. Actually, it is written in the GP 1 year. But she will say. Then more during, is it more during day or night? Is it then you is it what is then what is making you worse? Walking, what is make you did you notice that anything is making it worse? The itching. For example, like using soaps or bubble baths, is it increasing? Did you notice that it is increasing? Then that is then any anywhere else other than the vulvar area, the area down below, any other area, do you have itching in any other area of the body? Like wrist or neck, that is about the itching. Second point in gynec history, that second thing is you, even if she doesn't say or even the GP doesn't say, so you know because GP has given you the picture also, the photo will be there. Here I did not show, but sometimes GP will give the image of that lichen sclerosis. So because you know it is lichen sclerosis, you have an idea about it, you need to ask. Otherwise also in vulval conditions, you need to ask itching and also any change in the skin color. The second thing which you should ask is, did you notice any change in the skin color in that area? Or any, the skin in that area, is it thinning? Did you notice any thinning or breaking? So change in the skin color, thinning and breaking. Because in lichen sclerosis, the typical thing that is that it becomes very thin and so typical appearance will be there. And so you have, is there any thinning or breaking? Okay, now is it spreading to back passages? Usually it spreads to back passages also. Is it spreading to back passages? Do you have any issues with the bowel or back passages or any waterworks? Do you have any problem or bladder you can say or waterworks? Do you have any issues? So bowel and bladder are important because it is all nearby. So then that is about the history of present illness complaints. Now second thing, can you ask a few personal questions? Are you sexually active? Always say this type of sexual active, you say personal question. Are you sexually active? If she says yes, Then only you ask, is it affecting this condition? Is it affecting your sexual life? If she says no, no doctor, then no need to say, is it affecting your sexual life? So without asking you're sexually active, don't ask, is it affecting your sexual life? Because it won't look nice when she's not sexually active, or then or my husband may not be, partner may not be alive. So if you don't ask like that, don't look nice. Always confirm whether she's sexually active or not. Then suppose she says, yes, doctor, I'm sexually active. Is it affecting your sexual life? That means sometimes it causes dyspareunia. Yes, doctor. Then you say, just sympathize with her. I'm sorry to hear. I'm sorry about it. But we are. Is your partner supportive? Because sexually problem, this problem is there. Is your partner supportive? Okay, okay, yes or no, she will say. Then, is it otherwise it's affecting your quality of life? Because constant itching and all, it may affect her quality of life. So itching in the public also, she will continuously, she feel like itching. So that is the affecting the quality of life. So other than sexual life, you have to ask the quality of life whenever there is itching. So that is the. Now, I could see that from your, I could see that you have taken some treatment from your GP, and that is, can you tell me what type of treatment have you taken? Can you tell me? So she will say some ointment and some cream. So then, how were you taking the treatment? How long you have taken? How long have you taken? That she will say. Then, can you tell me how you're taking care of that that area down below? How you're taking care of that area? That is vaginal hygiene. You want to know about the hygiene. Then, are you washing with soaps? Are you taking bubble baths? Because these all increase. That is why. And so then this is about the present condition. Then coming to the gynec history, because it's a gynec case, always gynec history first, then obstetric history. So gynec, have you attended your have the period stopped? Let's change also. We can say change. Have you attained have you attained menopause? Menopause will understand everyone. So because she's 56, you should be menopausal age. Have you attained your menopause? Then how when? Then are you using any hormone treatment? Sometimes they'll have menopausal symptoms. Are you using any hormones for any problem, for any issues? Then she will say yes or no. If it is yes, since how long and what medicine? If she no need to ask anything. Then taking about any so that hormone treatment, everything is over. The other thing what you have to ask is cervical screening, because it is done up to 65. You have to ask, are you regular with your cervical screening? And how are the report? Are they normal? So this is about the gynec history. And so have you been then pregnant history, obstetric history is not that important, but then you can go for the medical history, which is relevant to you. Then medical history. Are you are you on any long-term medication for like for increase in sugars or any thyroid problem? Because these two are related to this condition. Thyroid and diabetes, they are related. Are you on any taking any medication like for increased sugars or any thyroid? So no worries. Or any, do you have any other skin problem? And any allergies? Any allergies? Huh? No need of blood group. It's not important here. Any surgery, then surgery also is not important. Then family history. Any family history of any cancer, disease, do you have any diseases that run in the family? Especially skin cancers and skin conditions in the family? Anybody has any skin cancers or any skin conditions in the family? Then, can you tell me whether you smoke, take alcohol, and pardon me for asking drugs? Can you, what is your BMI? Can you tell me your height weight ratio if it is not given? But it's given here 26. I see that your height weight ratio is normal. Then, how is the support at home? And then, because you need support because you constantly have this problem of itching and other. So, how is it affecting your mental health? Are you becoming down? Is it making you depressed, down and depressed? Because it is a chronic condition. Since 1 year she is suffering, it is a horrible condition. So, is it affecting your mental status? Are you becoming down or depressed? Do you need any counseling? If she says yes, doctor, then you say, can I arrange a counseling for you? So, then that is about the history or now information gathering is over. Would you like to add anything? Yes, that always you have to ask. Examination. Now coming to the examination, let me tell you, the examination findings are given here because the GP has given the examination findings. Okay, so No need to examine again. If the GP has given the examination findings, you need not do examination again. So, Jasmine, the GP,
मैंने भी नहीं की, पता नहीं कैसी है ये।
GP has, I can see from the finding, the GP finding, then let me just find. So, I will explain to you in a while about your condition. So, then,
यार तो
uh,
जांच
coming
करवानी
to the
पड़ेगी
blood
तो
reports,
तुम्हारे
coming to the blood
वो
reports,
रख दिए।
please mute your mic. So, I have confirmed your name, age, and NHS number on your blood reports. You show with your finger on that. That report is in front of you. You show this. So here it shows that your blood strength is lower. Put your finger on that hemoglobin. If it is, you get that idea. Otherwise, no need. But you remember and tell. Your blood strength is low, and your blood cells, are bigger than normal. Bigger than normal. That could be because of the vitamins, some vitamins which are low, like folic acid and B12. The other tests are normal. You just say one word, other tests are normal. Your sugars are normal. So, so then in that case, because the cells are bigger, we need to check your blood folate and B12 levels in your blood. And sugar is normal. Thyroid, if suppose she is symptomatic, then you check the thyroid. Then, so this is about the blood test you have explained to her. The second thing is from your history, from your history, Jasmine, and examination findings, and that is the GP examination findings. From your examination findings, you have a skin condition. You have a skin condition called lichen sclerosis in medical terms. This is a condition which is it will be there for long period of time. It is called a chronic inflammatory condition of the skin around the vagina. They will know what is vagina. Everybody knows. Vulva, sometimes they may not know. That is why you say it is a long-term condition or chronic condition of the skin of the area around the vagina called vulva. You can show a diagram and show. Diagram is always important when you explain. It causes, this condition it causes itching and thinning or breaking of the skin. And it occurs. Why it occurs, doctor? She will ask, why it occurs, doctor? Or if she doesn't ask, you can say, it occurs when one's body's immune system, that is at fault. That is a defense system at fault. So, when it starts producing some proteins that will attack our own body tissues, causing the skin to become thin and very weak, fragile, and it becomes a thin and breaks easily and looks like a cigarette paper like or tissue paper like. This is a typical appearance, and it breaks easily. But one thing, let me tell you, doctor, is it a cancer? No, let me tell you, it's not cancer. It's not cancer, but if it's not treated now, it can develop cancer after many years. Later on, long run, it can turn into cancer after a few many years. That is 5 in out of 100 can turn into cancer, if you remember. So the other thing is, which I would like to say is, doctor will, suppose she is sexually active, she can ask, or that whether it can spread to my partner or husband. Then you say, no, it is not, it doesn't spread. So these are the two things. It is chronic, but it is not contagious, it is not cancerous. But if it is not treated, it can turn to cancer. So now, coming to the treatment, we have medication. Let me tell you, you have to assure her because she is worried. Let me tell you, we have treatment for that. So, as you, shall I explain to you? Shall I proceed? Explain to you the treatment? Yes, doctor. Always break in and take.
मामा 2 मिनट आई।
So, as you did not respond, as you did not respond to the treatment given by the doctor, the GP, we will give you the high potency steroids. What the GP has given you is low potency steroid. We will give you the high potency steroid called clobetasol ointment. It is an ointment. It is a safe medication. It is a safe medication. And
आ रही हूँ।
how to apply? Let me tell you how to apply. You need to take a small amount on the tip of your finger. You show with the finger. I mean, just with your finger. Apply it over that area. My nurse will explain to you how to apply. So we give you 30 gram tube, 30 gram tube, and this should be used for 3 months. So initially you have to use it for initial 1 week. First 1 week first 1 month you have to use daily. Then second month you have to use alternate day. The third month, you had to use once in a week. Now, once the 3 months treatment is over, you need to come to us and come to us for follow-up. So we will see whether you are improved or not. But sometimes always you have to say the risk and benefits of the any medication. So this ointment is safe. Already I told you, but it can cause some burning. It can cause some burning initially, which will settle down over a period of time. As you continue, it will settle down. So after 3 months when you come, we will see whether your response. If you're responding very well, then you will be doing a follow-up with your GP. Your GP, you can see your GP. But if you're not responding, to the treatment, we may have to, after 3 months of correct use, we may have to take a small sample, small tissue from that area, that is called biopsy, and send it for testing under microscope to see what condition you have. And depending upon the report, we will treat you. So what does this medicine do? This medicine will make the skin soft and reduce the inflammation. Already you told her that it's a chronic inflammation. So it will reduce the inflammation, the chronic inflammation, and then it will make the skin soft. So am I clear so far? Okay. Then the other thing which I would like to tell you, this is about the medication. The second thing which I would like to tell you is some lifestyle modifications. That is, excuse me, please, Mike, mute your mic. So wash with we advise not to use soaps and bubble baths because it will increase the itching. We advise wash with the emollients. So wash with emollients and don't avoid soaps and bubble baths and panty liners also. You should tell her what to use and what not to use. Because then after passing urine, you need to keep that area dry and try to wear loose clothes. So these are the lifestyle modifications. The second thing. The third thing which I would like to say is, if she is sexually active, you can say, because if it is sexually active, it can cause pain during dyspareunia. So if she complains that, you say use some lubricants. Lubricants, and also if it is not working, any steroid cream we are giving, with the steroid cream what we are giving, usually the area becomes better. But still, if you have the problem of difficulty in having pain and during intercourse, you can use some dilators. We will also connect you to the counselor if you face such problems. Okay. Now, this is about the management which we will advise you for your condition. Am I clear? Okay. Now, I would like to say stress some points which are very important for you because you need to do self-examination. Every month, you need to do once examine yourself once in a month. And then whenever you notice any change in the color, any change in skin color, or when you notice any new lesion is coming, any new thing is coming, you see us immediately. Because I already told you, this condition can change to cancer, 5 in 100 cases. So we need to, that is why you need to do a self-examination, which is a very important safety point for you. Then you have to see your GP yearly. Every month you need to do self-examination. Yearly you need to be under follow with the GP. So any other concern? Then she will say, yes, now you have given her explanation, how to use the medication you have given, how to use the medication. You told her clearly when to come for the follow, what is the effect of medicine. It can cause some burning, this thing, but it is a safe medication. It is effective and makes the skin soft, everything you told. If she responds, she'll continue with the GP. If she doesn't respond, then you have to take a tissue biopsy. So this is the outline. Now closure. Now I'll already you have asked, do you have any concern? So now I will document whatever we have discussed. I will give an information leaflet and connect you to the support group and counseling also, because sometimes this is long-term condition. It can affect her mental status. And also I'll write back to GP. I'll give an appointment with my consultant. After 3 months when she comes, I'll give an appointment with my consultant. So this way, thank you for your time. So this way you're going to manage this case, gynae case. Okay. So with this, we come to the end of these 6 stations, what we told you that we'll be taking. So 6 stations you have. I've given you one from each module. So just a rough outline we have given how we teach you and what type of teaching we do. And so the audio teaching is always I prefer, because you will know how I'm talking to the patient, the way we talk to the patient, the way we address her, depending upon her situation, whether she is in a happy mood or a sad mood, we have to modulate. If you see the slides with all the written things, you won't know how to address the patient. So every case I will be telling you this is important, this is important. So you, when I keep on telling you, you will never forget in the exam. Like for example, LMP we tend to forget, but that is a patient point, important safety point. If she is pregnant, but then you're going to give contraception without checking her pregnancy, that is something it is. And also giving medicine without checking the allergies. So whenever I show the slides, it will not remain in your mind, but if I stress these points, then it will. So that is why our way of teaching is like this. We will give you the explanation. I'll be giving you explaining the station how to present. Of course it is not in 10 minutes. I take time because I'm explaining you, and after listening to that, you present it to Dr. Padma. She's our mentor. So tomorrow, who are all interested, present all these all the 6 cases to her. Tomorrow will be the same time, 7 to 9. And after that, you decide whether you would like to join our course. So, but we got a very good result with this type of teaching. I can say we get good results. So, thank you all for attending this session, and thank you, Dr. Hira, so for giving us a chance to take part, to be a part of your group. And thank you to the exam team also, the support team also. Thank you, the support team also. And Dr. Padma, over to
Yes,
Padma.